This is one of the more exciting news that we've seen over the past couple of weeks. The AstraZeneca clinical trials differed from the other two vaccine trials in that not only did they compare a placebo group to a vaccinated group, but they actually tested two different doses of the vaccine, which is why we're seeing two different efficacy rates. And they have come out to say that it was by error that one of the doses was given, but they did decide to follow it through. And what they found was in the dosing plan that was 90% effective, participants actually received half of the vaccine dose initially, followed by a full vaccine dose a month later. And the arm of the study that received a full dose of the vaccine initially and then a full dose of the vaccine 1 month later was actually found to be lower efficacy at 62%. And that's extremely intriguing. That's not something we would expect. We would expect, why a full dose vaccine being given twice to have more of an efficacy. And we still don't know at this point why that is. Why did we see this? There are a few different factors that we're speculating might have played a role, including the number of people in each arm of the study. The demographics of the people in each group, as well as the actual design of the vaccine, which uses a different virus as a vector. And so this data is still has to be reviewed and released. And so I'm sure we'll be hearing a little bit more about that in the coming few weeks. The AstraZeneca vaccine actually uses more of a traditional approach to vaccines. Rather than using the genetic code in an mRNA format that Pfizer and Moderna has used, this particular vaccine uses a weakened cold virus that is known to infect chimps. And they use it as a vector in which they have engineered the DNA code for the spike protein of the SARS-CoV-2 virus to be embedded within the genetic code that's delivered in this actual adenovirus. And so once the vaccine is given, the weakened virus infects our cells. The DNA is then transferred into our own cells and it's translated into mRNA, which then is used to make the spike protein of the SARS-CoV-2 virus. And this then, once it's released, primes our immune system. So that when this vaccinated individual does come into contact with the SARS-CoV-2 virus, it's ready to recognize it and it's prepared to attack it. It is true that the AstraZeneca trials were put on hold for several weeks, not just in the US, but the UK as well as Brazil, due to patients having some severe reactions. However, when they looked a little bit further into it, they found that they were independent of the vaccine, that the vaccine itself did not cause these reactions to occur. The trial was then resumed a week later in the UK and then a few weeks later in Brazil and US. In their press release last week, they did say that there were no serious side effects that were seen. And additionally, there were no hospitalizations or severe COVID-19 cases. So overall, at this point, this vaccine does seem very safe, though the formal data still has to be reviewed. So, we are unfortunately seeing rising number of cases across the country, hospitalization rates, and knowing that death rates do lag behind, we are expecting the death rate to rise as well. So all in all, it's very exciting to see another potential vaccine that's going to be out on the market. More vaccines means more doses available, so that way more people can actually get the vaccine. So that in itself is a win. But the AstraZeneca vaccine is unique in a couple ways. Firstly, it can be stored at normal fridge temperatures. And this is ideal for transport and distribution. We know that the Pfizer vaccine, the Moderna vaccines do require lower temperatures, and the Pfizer vaccine actually requires special freezer technology to keep it stable for long periods of time. So that itself is a limitation to global distribution. So this is good news when it comes to the AstraZeneca vaccine in terms of the transport and the distribution process. Secondly, cost is also a big thing. So this vaccine is much cheaper. The Moderna and Pfizer vaccines are estimated to range between $15 to $25 a dose. The AstraZeneca vaccine is going to be approximately $2.50. And moreover, the company also has committed to provide this vaccine on a nonprofit basis. So all of these factors combined make it more affordable, equitable, and easier to distribute, and not just to first world countries, but globally. So right now, we know that Pfizer has applied for emergency use authorization, and Moderna is expected to do so in the very near future as well. And now AstraZeneca, I'm sure, will be in line soon enough as well. So we are hoping that by mid-December, we will see approval from the FDA so that the distribution can start soon after. However, I will say we have to remember that we initially are going to have limited doses. It's estimated that about 20 million people can initially start getting the vaccine, and therefore certain groups will be prioritized. And that is going to be determined by the advisory committee of the Centers of Disease Control and Prevention. And so we are all, as healthcare providers, waiting to see the guidelines once these vaccines are approved for emergency use. I do suspect that earlier access will be given to high-risk individuals. So either people that are at higher risk of getting the infection or at higher risk of having a more severe infection. So these would include our essential workers, our first-line responders, people of potentially a certain age group, and people with underlying medical conditions. So more to come on that. With that said, though, I think once the initial batch of vaccines is rolled out, we will see more vaccines come through early next year. And so the hope is by spring and early summer, we'll have enough vaccines to start vaccinating the general public and those in lower risk groups.